We're going to learn more about strokes. Joining us today from Mercy Health St. Rita's, he is the stroke medical director and a neurointerventionalist. And we have Dr. Gheith, and thanks for joining us today.
My pleasure.
Can't say your whole title, but you're the medical director of strokes. And so since you've joined St. Rita's in June of 2021, what kind of changes have you seen being made in stroke care at St. Rita's?
Well, actually, there's been a profound positive change. You know, as most of your viewers may or may not know, stroke is really a very time-sensitive disease. It's one of those diseases where minutes make a difference. And so our whole focus at St. Rita's was to create a system that really focused on stroke time. So as a patient comes in, we've really redone the whole process to focus on getting them to where they need to go very safely and very quickly in order to maximize their ability to have a good outcome when they're having a stroke.
Okay, so you need to get there quickly and get going quickly. How do we know, what are the signs and symptoms so we know, oh yeah, I might be having a stroke, so I can get to you so you can help out?
You know, I like to use the mnemonic FAST. There's a mnemonic called FAST, so it stands for face, arm, speech, time. So if a patient's face is drooping, if their arm is weak, if their speech is garbled or jumbled, or they're just not making sense, or they're not talking, it's time to call 911. And you really want to call 911 and have the ambulance drive, you know, the EMS pick you up, because a lot of our protocols are EMS driven. So I know about you on the way to the hospital even before you reach me. So on our end, our CT scanner is ready for you. The team that's waiting for you as soon as you hit the front door is ready for you. And we really move very quickly to get you to where you need to go in a safe manner. And so that's what I would tell folks. Remember the mnemonic FAST, F-A-S-T.
All right, and get there as soon as quickly. Okay, so what kind of procedures, what kind of things do you do once a stroke patient arrives?
Well, I'll tell you, it's a very exciting time to be a doctor in the stroke field today. You know, we've made dramatic improvements in our procedures and in outcomes over the last 20 years. The mainstay of therapy, you know, and like I was telling you, stroke is a time-sensitive disease. The mainstay of therapy is a clot-busting medication called TPA. And that patients are eligible for, certain stroke patients are eligible for about the first 3 to 4.5 hours from the symptoms onset. What I want to tell folks is don't guess, don't waste time, don't sleep it off. You know, we can do amazing things, but if you get to us too late, there's unfortunately nothing much we can do for you. So that's one of the treatments. The other major treatment option that now we have the capability of doing at St. Rita's is something called mechanical thrombectomy. And that's actually a surgical procedure that me and my team do. And that basically requires me to put a catheter in the body, and I go up into the brain and I remove the clot manually. And we've been very successful in doing that, and have created a dramatic improvement in patients' outcomes with that.
Wow, that does sound wonderful. And because sometimes stroke patients, I guess the ones maybe who waited too long, you know, they have to go through a lot of therapy and don't always get movement back and things. But I assume with these two procedures, like you said, the outcomes are better.
They are, and you know, stroke is one of those diseases. It's actually the 5th leading cause of death now in the country. It used to be number 3, but it's now number 5, thankfully, because of these efforts. But it's still the 5th leading cause of death in the United States, and it's actually the number 1 cause of disability worldwide. You know, stroke doesn't just affect the stroke patient. Stroke affects everyone around that patient as well. You know, family members, loved ones. And so, you know, we all need to do our part in raising awareness for this. What I tell folks, again, just to reiterate, remember the mnemonic FAST, F-A-S-T. If you're having any of those symptoms, or you or a loved one is, it's time to call 911. Do not waste time with this. It's better to be safe than sorry. Okay, so you definitely want to come in as soon as possible. The sooner you get to us, the more chance we can give you to get to have a good outcome.
Wow, some really great information, Doctor. Thanks for sharing with us today.
My pleasure.
All right, don't go away. New Edition continues in a moment.